Diabetes complications are something you should know about when you have diabetes. Diabetes, or hyperglycemia, is a condition where insulin produced by the pancreas is either inadequate or is unable to convert glucose into energy. This causes blood sugar levels to increase and become dangerously high. This information should help you better understand what can happen when diabetes is left uncontrolled. While kidney disease and/or damage is one of the more common type 1 diabetes complications, it can occur in gestational and type 2 diabetes as well. Heart cardiovascular disease is not uncommon with uncontrolled diabetes. According to the American Heart Association, cardiovascular complications are the major cause of fatalities in diabetics. Nerves diabetes complications involving the nerves is called diabetic neuropathy, which can cause pain, tingling, numbness, and can affect the ability to feel sensations usually in your hands and or feet. Atherosclerosis. This condition is where your arteries harden and narrow due to cell death that occurs from thickened blood from the pile-up of glucose in the bloodstream. This causes your heart to work harder to clump thick blood and causes a decrease in proper circulation. Tissue damage. This is another form of cell death that causes the kind of tissue damage that results in amputation. Most commonly, the big toe is affected first, but your whole leg can be affected when diabetes is not treated and controlled. This can lead to whole leg amputations in severe cases of diabetes. Retinopathy. Those with diabetes for many years can experience damage to the eye, in particular the retina. Symptoms of retinopathy include floaters, caused by eye bleeds, blurred vision, loss of vision, poor night vision, reading difficulties, and blind spots. Yes, it can lead to blindness. Low blood sugar. Another complication that can happen with diabetes even with treatment is the development of hypoglycemia, which is low blood sugar that can become very severe. This is one reason it is important to test your sugar levels as directed by your doctor. Liver diabetes complications. Liver-related damage is also due to the lack of being able to properly filter your blood when glucose levels are high. Ketoacidosis. Ketone is a protein that is produced due to the body's inability to process glucose. This condition is toxic and affects your central nervous system, your brain, your heart, and your other major organs. It occurs mostly in type 1 diabetes and can be fatal. Some of the risk factors that can lead to diabetes complications include genetics, obesity, and a sedentary lifestyle. This is why it is so important to seek out more information on diabetes and get diagnosed and treated. Some of the most common diabetes symptoms include fatigue, extreme hunger and/or thirst, rapid weight loss, headaches, and frequent urination. If you experience any of these symptoms, you could be at risk for diabetes and you need to see your doctor. All of the above information about diabetes should give you cause to be tested when symptoms begin so you can get the condition under control as soon as possible. When these symptoms are ignored, you can and usually will develop some of the above diabetes complications. Learn more at diabetes-complications.net.